My name is Melanie Mariano, and my project next year will involve being at the Free Library of Philadelphia, providing reliable and accessible health services as well as preventative health services. In Philadelphia, there are a lot of individuals who are of low socioeconomic class, who are homeless, who are veterans without support, and they don't have primary care providers. And so where do they end up going? A lot of the time, they end up at the library. With the President's Engagement Prize, I'll be implementing a program with a nurse in the library, and that could include blood pressure screenings, weekly HIV testing, or STD counseling, and that could save, in the long run, a lot of healthcare dollars.
There's a real need for health information across the board in Philadelphia. 40% of adults in Philadelphia are low literate, meaning they don't read. They can only read maybe to a 5th grade level. That translates into every aspect of their lives. So we're working on literacy at all levels, and that includes health and nutrition.
My inspiration came from a community health course that I took in the fall that was taught by Dr. Harmon. During that class, I was placed in a clinical rotation at the Baskerville Library.
Melanie took my class, Nursing in the Community. We start with assessment. What are the things that you see in those communities that could impact health? So who's on the streets? Are there places to access care, food? Are there schools? Because that'll impact the health of people in that community.
The Free Library of Philadelphia is a safe haven for a lot of people to congregate. And if there was a nurse in the library consistently, that could empower patrons to realize that they have agency over their health and that maybe this is something they can handle.
A program like Melanie's is so important because it brings healthcare to where people are. When people are comfortable, you tend to have the best results.
I'll have a whole team behind me. I'll have nurses, I'll have volunteers who will help engage patrons and survey them and ask questions, and maybe work study students who will also learn what it's like to be in the community health setting.
Communities are built around anchor points, and Melanie's project uses one of those anchor points, the public library, to bring critical medical assistance to people in need.
Melanie is like a quiet fire. You don't realize that she's very gracious, very calm, but what sits inside of Melanie is so powerful. She took this idea and I believe she'll take it all the way.
My mother is a nurse and my father is a surgical technologist, so giving back is in my blood, and that's why I came to Penn, because Penn really emphasizes giving back and helping others, and that is what the school is all about.